Hey, it's Dr. Bill with just the tip of urology school. And today we're going to discuss urethral stricture disease. In the anterior urethra, where there is spongiosum backing up the urethral mucosa, we call them strictures. Uh, Posteriorly, there's no such spongiosa. So we call that area stenotic or contracture. They're basically a result of some sort of trauma that can replace that normal soft uh, tissue with a fibrotic scar. And so this can be a function of trauma, physical blunt trauma, uh, penetrating trauma, sexually transmitted diseases, catheterizations, or even controlled endoscopy, radiation therapy, lichen sclerosis, hypospadias can result in urethral scarring, not only developmentally, but for the particular treatment. And it's also idiopathic. The most common location is the bulbar urethra area. So when we look at a patient who we suspect some sort of scar, obviously the history and physical, demographics, and sexual history are real important. It's essentially going to be a presentation of bladder outlet obstruction that may be very difficult to separate from prostatic enlargement in the male or vaginal prolapse in the female unless we take a good look at history and physical exam. So when we're doing a physical exam on patients with urethral stricture disease, we want to pay particular attention to the tissue health along the perineum, the scrotum, and even the oral mucosa. These are areas where grafts can be used, hairless grafts can be used to help bridge strictures if necessary. After you are making an assessment and considering outlet obstruction, you may want to use a Uroflow retrograde urethrogram, a voiding cystourethrogram. Sometimes they're done spontaneously, so you can identify proximally and distally where the scar begins and ends. Cystoscopy and ultrasound can also be utilized to assess the length of the scar. When we are looking at treatments, urethral dilatation with Van Buren sounds or filiform and followers, actually interesting techniques, and there are a number of videos available on the core curriculum of the AUA website. DVIU or direct vision internal urethrotomy, looking at distension, hydrodistension, basically in the male when they're urinating, have them pinch the tip of the penis, and that will hydrodistend with the backflow and increased pressure of the urine in the area where the stricture has been addressed. And there are a number of different graft procedures that can be utilized. So interesting stuff, a nice uptick in your evaluation of urinary retention, both men and women. Remember your resources in the AUA websites. Dr. Bill with just the tip of urology school addressing urethral stricture disease.